It's important to have a historic perspective on both the diagnosis and treatment of Alzheimer's disease. This is a disease that was thought to be rare. Back in 1906 when it was described actually in a young woman who developed symptoms in her 50s. And back then the thought was that really multiple different conditions caused senility in older individuals, and mostly heart and limb arteries. And that Alzheimer's disease is defined pathologically by amyloid plaques and neurofibrillary tangles that we found out later on that these are the components, these proteins in the plaques and the tangles. The thought was that this affected only younger individuals. It wasn't until the 70s really that there was an appreciation that most people who are older and are showing symptoms have Alzheimer's pathology in their brain. And more recently, in the last 5 or 6 years, there's been a greater appreciation that the disease itself, the hallmarks can start 15, 20, 25 years before symptoms onset. And that whereas young individuals may have a very pure form of the disease, older individuals likely have multiple conditions that lead to kind of impairment and dementia. And Alzheimer's pathology is one of them, but it's not the only thing that's involved. So as far that's on the diagnostic side, also an appreciation it's not just memory that's involved, that individuals can, depending on their vulnerabilities and reserve, show symptoms in different ways. So for many typical patients, it may be difficulty with new learning and remembering new facts or life events. But it doesn't have to be that way. It could be difficulty with executive function, multitasking. It could be visuospatial abilities or language, coming up with the right word. And in many individuals, there's actually a mood component and sleep component that becomes obvious years before people show cognitive symptoms. So this could be anxiety or depressive symptoms or sleep problems. So that's really the behavioral aspects of it have also been appreciated much more. And ultimately on the treatment side, we have multifactorial treatments that involve really early diagnosis or timely diagnosis, behavioral interventions, medications, both taking away bad medications and adding the approved medications, managing symptoms, managing the environment, having a new language and a care environment that's conducive to different stages for individuals. And ultimately, having a partnership with the patient, the individual, and their care partner, and really taking care of the care partner who becomes, in some ways, a patient also, because their health and their well-being really affects the affected individual's well-being. So that's sort of the overview. And then more recently, there's been, because of the advent of biomarkers and seeing the disease process years before onset, there's a move towards being able to have a more pathobiological definition that may be disconnected from the symptoms, and coming up with different treatments that can affect amyloid and tau and maybe even other things that affect cognition and brain function, including inflammation and vascular brain changes. And so it's an exciting time, even though we've had a number of failures in trials. We're learning a tremendous amount.
As of spring 2019, we've had some disappointing news in the field of development of drugs for Alzheimer's disease. Aducanumab, which was one of the major antibodies against the amyloid protein, was discontinued in 2 major international trials just recently. This is very disappointing to us because we had high hopes for this trial insofar as it showed that we could remove the amyloid from the brain. But the second question was, did it make any difference clinically? And apparently the studies were stopped for futility because there was not a clinical benefit from the drug. Nevertheless, that doesn't mean we're out of business. It was a major trial, but we're still moving forward. We think that there are many important therapeutic targets, among them amyloid, that still need to be explored, and there are 50 to 60 compounds under investigation at any given time.